this child suffered a major problem, and have it be put in perspective, as long as we're doing the best that we can, there will be, there's every effort being made to ensure the safety. But it's like taking kids in a car. You know, if you want 100% safety, don't put your children in a car, because there are car accidents. And so it's up to the child welfare system to learn the best ways, utilizing current technology and the availability of information that we didn't even have even a decade ago, to help with the evaluation, but to streamline it so that we can have the number of foster homes that we need, that are prepared, that are willing, and that are a safe place for our foster children.
So it sounds like the bottom line is for them to get into the 21st century in many ways.
Absolutely. When we're talking about ORCIDS, this data system that Jamie mentioned, we spent $76 million, double what was estimated, for a system that has never worked. Has 1,000 fixes that are needed, and I mean, it's never going to happen. It's fatally flawed, in my estimation, and having been through a number of failed IT projects, there comes a time when you say, guess what? This Band-Aid that we keep putting on is not going to fix this cancer. This system needs to be replaced. I believe that that's the case. I'm not an auditor, and so I can say that they stay just with the facts, but I think you need to draw conclusions. If something's not working, you know, if the hole is in the wrong place, quit digging and go to where you can have the resources that you need, learn from other systems on what's working, and make the changes that are necessary. Let me close with one thought. I was in legislature when our mental health state hospital was, or state mental health hospital was not functioning. We had patients there that had no treatment plan, that were just being warehoused, and they didn't have enough staffing. And finally, a federal judge got involved, and not just a federal judge, but also the Senate president, and something had to be done. We now have an exemplary state mental hospital. The way that it's functioning, it was very expensive. Before this was done, we didn't have the money to address it. It went on decades and didn't get addressed, but it got addressed because it had to. And so I believe that Oregon faces a crossroads. Either it can take responsibility to bring about the changes and come up with the solutions and start implementing them now, or we go along, continue to harm children and lose caseworkers and lose foster families because of lack of support and training, until a federal judge orders us to face up to this problem and fix it. I say we should do the former.